Mercy Maricopa Integrated Care, when coverage for the mentally ill will be enhanced by the settlement of Arnold v. Sarn, a decades-old lawsuit. Here to talk about all this is Charles Chick Arnold, the attorney who represented the mentally ill in that lawsuit, Eddie Broadway, CEO of Mercy Maricopa Integrated Care, and Corey Nelson, Deputy Director for Behavioral Health for the Arizona Department of Health Services. Good to have you all here. Thank you so much for joining us. Chick, I want to start with you. You've certainly been on the program before. We've talked about Arnold v. Sarn. I want to get to that in a little bit in a second. But from a grand overview, what changes?
Well, there's a lot that changes, Ted, but primarily it's a reason for optimism. A number of factors have come together to allow this optimism these days in our community. The Affordable Care Act, the passage, the governor's restoration of the Medicaid program, parity in insurance to provide for equal coverage for mental health issues. All of that has helped result in the transition to a new regional behavioral health authority in Maricopa County. That's Mercy Maricopa as compared to Magellan Healthcare. Mercy Maricopa is local. Mercy Maricopa has embraced the notion of integrated care, which means providing for a person's what are considered primary care needs in addition to their mental health needs, and it's a not-for-profit company, all of which I think helps the people in our community.
The integrated care seems to be a major focus here. What exactly does that mean?
Well, here in this model, integrated care means several things. For the most part, there's several different models. One starts out with, number one, the member decides on what services they want, but they can choose basically to select to have all their care delivered in one place or into separate places. But integrated care itself is basically where you bring both behavioral health care and the physical health care together.
And it sounds like collaboration is the key here. Integration, collaboration, that kind of work together, don't they?
It's absolutely critical, Ted. As we've discussed on this show before, people with serious mental illness in Arizona generally have a 32-year shorter lifespan than those without such an illness. Often, the cause of death isn't a mental illness. It's physical issues that are unattended, largely as a result of a mental disorder. The notion of integrated care gets right to the heart of that issue and provides consumers with an opportunity to get their primary care needs addressed at the same time as their mental health needs.
Was it, again, moving a battleship kind of a change in terms of getting all of this collaboration, all these folks under one tent, if you will? Talk about the dynamics there.
Well, I think there's many systems at play, and it is almost like moving a battleship, but we have to start at small pieces. So the first piece is basically getting everyone to the table and talking and sharing information. So the health information exchange is going to be the first step, which is really key to the underpinnings of this. So you have your physical health doctors and providers talking to your behavioral health and sharing the information. And then their bigger systems development, which will start moving along of the models, such as the fully integrated clinics, and then the member chooses to maybe go to a PCP or a psychiatrist as their primary home.
Member chooses, or perhaps family members help choose. Again, is that dynamic different than what we've seen in the county in the past?
I think so. Over the years, we've had a smaller selection. And when we had a bifurcated system for physical to behavioral, and they were really separated and weren't talking, the behavioral health was definitely, the behavioral health side of the shop was definitely less of an opportunity for member choice and members to move around the system like they would want to.
Arnold v. Sarn.
One of the things that the settlement agreement provides for are continuing quality service reviews. So while the case has indeed been settled and resolved in its principle, there's continuing review of the system through the process provided for in the settlement agreement. There will be independent quality service reviews to assure that what the vision of the provider and the department is actually manifested.
And so that is part of the deal, correct?
That's part of the lawsuit and has been embraced by the providers and is part of the contractual agreement that Mercy Maricopa will have with the state.
As far as Mercy Maricopa and what you are doing here, is it modeled after a program somewhere else in the country, or is everyone else in the country looking at this as a model?
That's a very interesting question. I think there are parts of it going on across the nation. This is really more the trend. To the extent that in the scope of this contract, this is probably the largest undertaking and the first of its kind.
Wow. All right. So, are you ready for it?
We're ready.
Yeah. You think they're ready for it? I mean, it's public healthcare service in Arizona. We've done so many shows on this. There's so many concerns, right, left, in the middle. For those who are in the system, for members, if you will. Again, how do they see optimism in this? How are they going to see something get better?
Again, I think what they can see get better is that they are treated like the rest of us want to be treated, as a whole person. They're not left behind. I mean, most of us right now in our own private insurance, you know, we can go to the provider we want, whether it's behavioral health, physical health, whatever it may be. Behavioral health in the public system hasn't always been that way. So the fact that they're going to be treated as that whole person equally and treated very importantly, I think is a huge step for us.
As far as experience for Mercy Maricopa, what kind of background, what kind of experience do the folks who will be involved in this in Maricopa County? What do they have in terms of a background for integrated care?
Mercy Maricopa is a new company, but the sponsors that have been involved in this, including Maricopa Integrated Health Systems, Dignity Health, St. Joe's, which is a part of that, have been doing integrated care, and we come with that experience. And the models that we've really adopted have been tried across the United States. So we feel that we're set and ready to go for that.
Is that a lot of folks that need to work together? Can they work together?
Yeah, I believe they can, and I believe we have the quality measures at a lot of different levels to make sure that they are working together for the right purpose, and that purpose is for the delivery of service to the member that improves their lives. So I think between all of us and the contractual requirements that we have in place and the monitoring, I think it will continue to drive the system forward.
And you are optimistic, correct?
I'm feeling really good about it, absolutely. But the elements that we do have control over, I think, have been adjusted in a positive way.
Gentlemen, it's good to have you here. Thank you so much for joining us. We appreciate it.
Thank you.